I'm Dr. Rajeshwari Ganesh and I'm a Consultant Developmental Pediatrician. ADHD is a very common terminology that we come across these days. ADHD, the full form is Attention Deficit Hyperactivity Disorder. Children and adults who are diagnosed with this condition often find it very difficult to pay attention to activities, usually in everyday life. So usually in children will struggle with paying attention to everyday tasks like getting ready, brushing their teeth, taking a bath, writing assignments in school, completing their work. They will often not sit in one place. They will need frequent reminders to finish their assignments, and they often forget instructions and they need repeated reminders for tasks. And also, they are very poor in their impulse control. So they will leave their parents' hand and run. There will be safety concerns noted. And they need plenty of redirection to sit in one place and focus. Now, if your child is having any or all of these symptoms, it is important that we get this addressed right away, because we all know that the early brain or the pediatric brain or the child's brain is very, very amenable to change. Early intervention and early addressal of these issues can bring about huge positive changes in the child's life and also the family's life. But the question is, how do we go forward? If the teacher at school has pointed out these concerns to you, what should I do next? Should I get him tested for ADHD or not? Testing for ADHD is clinical. What I mean by clinical is that there are no blood tests to diagnose ADHD. There is no MRI brain that we can do to diagnose ADHD. ADHD remains a clinical diagnosis. By that, I mean that people who are involved in your child's life, like the school teachers, the tuition teachers, we ask them to give us some input about how the child pays attention, how the child sits and completes tasks. This information we get by means of questionnaires. So there are many questionnaires available. Some of the questionnaires that we use are the Conners rating scales and the Vanderbilt pediatric rating scales. After we get information from the teachers and from the parents about how the child is able to pay attention for tasks, we do one-to-one testing wherein we give children certain tasks. So we'll give them puzzles or we'll give them certain drawings that they're supposed to copy. And in that, we are able to judge how the child completes the task. Does the child sit through? Does the child need frequent reminders to complete the task? And what is the quality of the work that the child has completed? After all these tests are done, then we are able to make a diagnosis of ADHD. ADHD, the earlier we diagnose and the earlier we correct, the better outcomes for the child and family. Thank you.